Recently on the show, we had a chance to head over to Brainerd Primary Care, have a chance to introduce you to the two nurse practitioners who are there. We are back this morning talking with Taylor Ruyak and Katie Campos. Good to see you again.
Good to see you.
So last time we had a chance just to kind of find out who you are and what you are, and the great news for people watching is that you're a primary care office in the East Brainerd area, and you're accepting new patients. So a lot of folks are excited to welcome you to the town. But let's talk a little bit this morning about what you see when people are coming in the door. I know you treat all different types of health conditions, but y'all are both real big on prevention, aren't you? Mm-hmm. So let's talk the fact that here we are on the cusp of summer. Everyone's trying to get in shape, have that beach body, even if it's just a lawn mowing body, right? It's not as easy as we would like it to be. So y'all are kind of life coaches for people too. Is that right, Taylor?
Yeah, Katie and I both are really passionate about just helping our patients implement simple new habits that can really improve their health overall. So we love taking the time to coach people through, and it takes time because you can't change all your bad habits in a 30-minute visit, but we love following up with our patients. And
I hope this comes across the way I intend it to, but I think you are both at the prime time to be having that message for people because you're completely relatable. I know you're an 18 and up office, so you can totally relate to the teenage college student who might come in. Obviously, anybody in their 30s and 40s, but then older people, you've got people in your lives who are that age group, so you can really relate, I would think. Yeah. You're big, Katie, on, if you possibly can, reducing medications. Is that right?
Yeah. Well, we have a lot of patients that come in and they're like, this is my third blood pressure medicine I've been added on recently. Nothing seems to be working. And so instead of just maybe adding another medication or sending them to maybe a specialist, really just talking basics, like what does your day-to-day life look like? How much do you exercise? What are you putting in your body? Genetics is always something to consider as well, but there's a lot of things that people can do personally to make a difference on their blood pressure, cholesterol levels, weight, overall energy. A lot of things people know, but kind of just a reminder and then how to actually implement that change into day-to-day life.
How much of your day should be spent listening as opposed to talking? Do y'all do a lot of listening?
Yeah, I would say, and to understand truly what a patient's going through, you have to listen. Yeah. And I think patients are looking for people who are willing to listen to them instead of just, here's a prescription, come back and see me in a month or two. So listening is huge. And then just learning how to quickly offer some suggestions for recipes, exercise regimen, people that can help. I think a multidisciplinary team is huge, not just a doctor, provider, nurse practitioner, but how do we implement maybe psychotherapy, a nutritionalist, someone who's an expert on diabetes, but maybe we don't have the time to sit there and talk with them. Right. So just plugging them into resources and having as many people in their corner as possible to support them through a change.
Well, and that does take some time. I know you can't do all of that in one 30-minute visit, as you say, Taylor, but the fact that you can begin that relationship building with people is really important, because if they come in to see you, they could theoretically come back in 3 months and say, look, this is just still not working.
Yeah, I think it's really helpful just for someone to have kind of an unbiased accountability partner that can just cheer them on, because oftentimes people don't want to hear it from their mom or their spouse or whatever, but when they can come to us and just know that we are truly concerned about their health and want the best for them, I think that helps just to have someone they can rely on.
I guess we have so much information in our heads. When you were talking earlier, Katie, about all the different things you can kind of coach people through, and I was listening to you, but in a way my mind was going, oh gosh, I could never really remember all of that. Sure. But I'm guessing that in the office you go at their pace.
Of course, yeah. Some people, you're like telling them the recommendations from different science journals about how much exercise they should do, but sometimes you can't just jump right into that. And I always tell my patients it's not always exercise. People think if I just got a gym membership, I could lose all this weight I want to, my goal for 2023. But a lot of times, I always tell people 70% of it is diet and 30% maybe is just physical activity. And that may not be the same for someone who's in their 40s versus someone who's 18. So yeah, just looking at where people are in their life, looking at labs is important too. So getting some baseline labs, following those. So just having some kind of monitoring through a program is really important, some guidance as far as what's appropriate.
Okay, so somebody comes in to see you for whatever their reason is. As a primary care office, if you notice something in the blood work that you get back or what have you, you can then refer to a specialist if they don't have one?
Yes, we have relationships with specialists all across town, and we have our medical assistant that helps us with referrals. So yes, we can definitely get people to the right provider if we can't take care of the issue ourselves.
Something I thought was a great idea too, I guess because it's where I am in my life, but you are 18 and up. But y'all will do telehealth after, you know, you're established, obviously. So if you have a child about to head off to college and you want that local relationship, but if they should get the flu or something on campus next fall, they can talk to you at the telehealth visit. Is that right?
That's correct. Once the patient is established and we know them, and you know, we've done any like vital sign monitoring that is appropriate, we are happy to provide telehealth. It's nice for people that are out of town or just for some reason can't get into the office that day. Yeah.
Well, I thank you both so much, and I'll try to be careful and remember that it's 70% diet, 30% exercise before that trip to the beach. So here's where you will find them. It's Brainerd Primary Care. We kept it a little bit light this morning, but truly anything that you have going on health-wise in your life, whether it is prevention at this moment or an illness that you're concerned about, let them maybe be your front line to then see where you should go from here, because all of us, even the specialists, will tell you need to have that primary care physician to keep us grounded. So here's her contact information, and thank you both so much.
Thank you.
Julia, what are you doing?